Okay, well, again, good morning, good afternoon to everyone. My name is Christopher Delgado. I'm a postdoctoral researcher at the University of Antwerp, Faculty of Medicine, and I'm glad to welcome you to this webinar organized by the University of Antwerp and the University of Hasselt. As you know, this webinar aims to bring statisticians and epidemiologists and talk about their perspectives and how's life after this master studies in Hasselt and in Antwerp. We are glad also to share with you the presentations and the experiences from 6 alumni from our masters who will talk about their experiences in their own countries. So because the time is short, I will give the floor to the Dean of the Faculty of Medicine, Professor Guy Hubens from the University of Antwerp to open this webinar. Professor Guy, please.
Okay. Hello, everybody. As Dean of the Faculty, the Faculty of Medicine and Health Care Sciences, it's my pleasure to offer you a warm welcome here in Antwerp, a warm welcome, although it's virtual, for this webinar. And I'm glad to see that so many people are attending right now at this moment. Although perhaps small in number of students, the Master of Epidemiology is a very important part of our faculty. This program is unique in Flanders. And since it starts, it has been already reviewed by peers for the 3rd time and always got a very good reward. So it's a very nice program, and it's a very important one because it stands for internationalization, and internationalization is one of the key principles, not only of the faculty, but also of the University of Antwerp. It's a very highly rewarded program because we see yearly more than 15 PhD students defending their work successfully. So we are very proud of the Master of Epidemiology. I'm glad to see that this work this afternoon is a joint effort both by the University of Antwerp and the University of Hasselt. And again, I wish you a very fruitful afternoon and hope that you will learn a lot and will be able to do the networking that this symposium is designed for. I want to thank the organization of this webinar to put Antwerp and Hasselt on the land map. And again, have a nice afternoon and learn a lot. GP, Neil, Christopher, congratulations for this event.
Thank you, Professor Hubens. All right, so now I will give the floor maybe first to Professor Jean-Pierre van den Kruggen from the University of Antwerp. He's organizer also of the Master of Epidemiology in this university. Professor Jean-Pierre.
Yes, good afternoon, everybody. So it's, I think, the 4th time that we organize this workshop, and it's the 2nd time we organize it online. So I will give a small introduction on the Master of Epidemiology to give some elements, and then I will give the floor to Neil Hens, professor in Hasselt and Antwerp, and who is the promoter of the Master Statistics Scholarships program in Hasselt. First, to set the stage, of course, amongst you, at least half of you are students in Master of Epidemiology or alumni, or maybe interested in the future to study epidemiology. And I give here to just break the ice the definition of epidemiology. Yeah? So it's epidemiology is a study, as a science, and it studies the occurrence and distribution of health-related states in populations, and also the determinants and the main aim is to do something with this. So epidemiology today is very the terminology of epidemiology, you hear it all around during the last 18 months. And we were in fact visionary 9 years ago almost by studying this, starting this master in Antwerp, as there was no training for an epidemiologist at that moment in Flanders. And we estimated at that moment there were about 300 positions filled in Flanders, which required the skills and competences of an epidemiologist, but which were mostly filled by people who had not a specific diploma in this field. So we started this master, and we train to prepare students to do research in clinical epidemiology, infectious disease epidemiology, environmental, genetic, chronic disease epidemiology, and to hopefully that afterwards they get or go for an academic career or go in advisory functions in NGOs, governmental organizations, health policy, public health policy, private sector, or for teaching research methods as a master. You can do that. Now, who would we thinking of? Of course, bachelors of medicine, biomedical sciences, veterinary medicine, pharmacology, physiotherapy was a logic in stream. Indirectly, there are some others here. What's in yellow here has to pass the educational commission. What's in green can go straight. So the direct green and indirect is through the educational commission. And you have also a bridging program. And also, and that's where we are together today, international students. Now, for English, international students has to pass also the education commission, but have to also prove it's all on the website, the English language proficiency. And so you all find this on the website. Here you see the link. So if you're more interested on the different elements, you can find it. You can find also on that website the learning outcomes, what we aim with this master program, what we do. And this maybe even for the alumni or those who are now in the first and second year of the master, this will be the program from next year on. So there are some slight differences. Some is a little bit of reorganization, but it's so we start with more the theory, the methods, classical and modern methods of epidemiology, then statistics, also qualitative research, data management. And so in the first year, it's more knowledge, but little by little, there are in all courses also hands-on exercises to learn the different competences that you need. And then little by little, we evolve toward the different fields that are mentioned on the former slide, like genetic epidemiology. Now, the big difference for those who are studying now at the moment, the master will be that the 3 tracks will be offered to all students from the future onwards. So that's a big change, and that there is a new course, which is mentioned here, applied arms, which is applied research methods, which will replace the internships. So this said, and this stays the same. These are all the skills and competences we would like to tick off at the end of a part of the aims that you saw at the end of the Master Epidemiology. Now, what is then unique? It's unique in Flanders, as I said. It has an academic career. It aids to professionalize scientific research. It's a mix of theory and practice. And we have a qualitative research component, which is strong, which is normally in a lot of Master of Epidemiology is not foreseen. Now, we can learn from each other through blended learning, teamwork, activating forms, blended learning forms. And also there are international students, and therefore I will come to the next slide. Because we have, it's in Antwerp, of course, that's one of the assets, but we are on the outside of Antwerp, on the campus the campus where we are not today, but we are online, but which is quite green and in nature and with in a healthy environment. Now, next, on top of this master, we, at a certain moment from the Global Health Institute, it's one of the research groups in Antwerp, we decided to apply for a scholarship program for colleagues from low and middle income countries. And that started, I think now, started in 2000, help me, 16, I think, 2016. And the reason was, of course, that we saw that also there was, at that moment, we did a little scanning. For example, in sub-Saharan Africa, we found only 2 official master's programs that offered a master in epidemiology. That was in Tanzania and in Ethiopia. There were several master of public health, but not really a lot of masters that really focus. So there's an enormous need in low and middle income countries on well-trained epidemiologists, and that's why we set up. And so the scholarship program, this was part, of course, of a larger portfolio of courses. So we have then the population genetics course, we have the EBQ, which is a short course mainly for PhD students, we have the infectious disease course, intensive infectious disease course, I3DC, and we have also, since a couple of years, with all Flemish universities together contributing to an inter-university program of global health. Last but not least, our goal, we think that we can play a main role if we want to make a change in low and middle income countries. We think that we have to work on people at postdoctoral level to strengthen the advanced learning programs and advanced graduates. And so we have put a lot of emphasis on PhD projects and PhD trainings, and there you find also all this on the website. So this is, so we are, compared to what we're doing, our group in Antwerp is relatively small. So we are the top, here you see the top of our iceberg in Antwerp. And here you see, of course, as an education group, we have several working in the 3 fields. We already talked about the teaching. Now for research, I recommend to go on the website. You can click or on a topic or on a country to see what is ongoing, which PhD student, which project is there, what collaboration we have there. So please welcome there. And in fact, if we would start going through all the research we're doing, we can put a lot of adjectives to epidemiology, seroepidemiology, clinical epidemiology, etc. You'll all see it here. They name it, and the list gets longer and longer step by step. So I think that was it for welcome to the show for today. So you will hear the aim of today is, of course, that you all people interested in studying epidemiology or statistics, and I give the floor to Neil in a couple of seconds, that it's to show that what are the job opportunities or the career opportunities with such a diploma. And so we will have some alumni of the Master Epidemiology and Statistics who work in different fields. One is working in academic setting, one in NGO, one in a governmental organization, Ministry of Health, and who will show them what their job is like and how their trajectory went after they had their diploma. And I give now the floor to Neil to continue.
Okay, thank you, Jean-Pierre. If you unshare, then I will share. Thank you. And you should be able to see my screen. Is this okay?
Yes, we see it.
Okay, thank you. So also good afternoon from my end. And most of you have seen my name before, of course, both in Hasselt as well as in Antwerp, because I'm affiliated to both institutes. But at the same time, I'm indeed the promoter of the ICP program at the Hasselt site. And together with Shella Feensoy, who is the coordinator of the ICP program, we try to manage this. So let me give some more details about the Master of Statistics for those who don't know the Master as such, and maybe some recent evolutions also for our alumni who will be presenting today. So I'm very, very glad and very humble towards the presentations of Edmund, Damaso, and Louis, alumni of the Master of Statistics program, and of course a very warm welcome as well to the alumni of the Master in Epi program who will be presenting today. So the Center for Statistics is actually was founded in 1998. It was actually founded on top of a research group working on statistical analyses, and that was a more theoretical group, theoretical statistics or mathematical statistics. And the Center for Statistics nowadays is a research group. at that time, it was really an institute as such, but as everything, a lot of evolutions took place, and the Center for Statistics is now a part of different institutes, and we have branches basically reaching out to other universities, and I will come back to that in just a moment. But since that is an entity of the Inter-University Institute of Biostatistics and Statistical Bioinformatics, which is an institute that connects the group at Hasselt with the group at Leuven, L-Biostat, the Leuven biostatistical entity, since 2008. And since that, in its own right, I think it's fair to say it's one of the largest centers for statistics in the whole of Europe. We are with more than 60 full-time equivalents, and this number is changing almost every week. I would say is a lot of evolutions again. With 12 professors, 4 emeriti, 13 postdocs, 29 predocs, 5 consultants, and we're all collaborating on the different fields that are key, I think, in academic work. Education, research, and consultancy, or consultancy in a broad sense of the word, not only really working for companies and so on, but also working for the government or for more societal challenges and so on. Nevertheless, we are a group of statisticians, let's say, at Hasselt. We do have a multidisciplinary background, so a lot of us have formal trainings in mathematics and then took on statistics in a master. But there are several and more actually people with a background in biology, psychology, computer science, physics, engineering, biochemistry, and so on. We're also very multicultural, and these are just a few examples. So a lot of our staff is from Flanders, but we also have staff from Poland, Israel, Vietnam, Indonesia, Cuba, Kenya, Ethiopia, Bangladesh, Philippines, Zimbabwe, Uganda, Nigeria, and so on and so on. And since last year, we're actually now part of a larger data science institute. So you could say actually that since that is about 50% of that new data science institute, where we're making the bridge towards computer scientists as well as people from the law faculty, from arts, and so on. It's a very broad institute as such, and it has recently been established. So in that sense, it's still maturing, let's say, towards an institute as such, but it can build on a strong foundation that the Center for Statistics has given it. In terms of the main research themes within the Center for Statistics, we have biostatistics, with Mark Aerts, Geert Molenbergs, and Lisbeth Bruckers in the lead. Statistical bioinformatics, Tomasz Burzykowski, Zev Shkedi, Olivier Tas, and Dirk Valkenborg. For epidemiology and public health, myself, I'm contributing here, Zev Shkedi and Christophe Vaas. For mathematical statistics, we have Roel Brakers and Anneleen Verhasselt. And for data science, we have Jan Aerts, who is into visual analytics. Now, although we assign names to each of these tracks, as such, it's not like you can put us in one box only, because a lot of people actually span more than one box. So I myself also work in biostatistics as such, and there is not such a big difference, at least from the statistical side, in terms of biostatistics and epidemiology and public health. But nevertheless, of course, there are specific ingredients to each of these tracks. And maybe the odd one out, maybe less familiar to you, is statistical bioinformatics. And we're very proud of the name statistical there, because bioinformatics is a very broad discipline. Also in engineering faculties and so on, you see bioinformatics being conducted and so on. But we focus on the statistical methodology underpinning these procedures that have been used and developed as such. So we're really fundamental in that sense, that we try to develop new methodology to tackle a lot of problems in terms of statistical bioinformatics. To show a little bit our international network of collaborators, we have put a few symbols on a map here. So, of course, we collaborate a lot with academic institutes worldwide, but at the same time also with many, many companies, really also worldwide, non-governmental institutes, governmental institutes, hospitals and clinical setting, platforms or networks that we are a member of, and then also, of course, the government itself, and especially in Belgium, but also further than that. So this map is also something very dynamic, so it's actually wrong for me to show a static picture here. Yeah, the network of collaborators is ever expanding, I think. And then we come to our education. So in teaching and training, we have a Master of Statistics, and now, and that's a recent development, it's a Master of Statistics and Data Science. Why? Well, one of the reasons, well, maybe I should go back a little bit in history. We started off with a Master of Biostatistics quite a while ago, but that Master of Biostatistics was then transformed into a Master of Biostatistics and a Master of Applied Statistics. And that was really for people that didn't have a strong background in statistics, for instance, first followed the Master of Applied Statistics and then followed the Master of Biostatistics. But then the Master was turned into what we now call a regular Master in Flanders. And in that sense, it's now a 2-year program, and we identified in the beginning 2 trajectories, Master of Biostatistics and the Master of Epidemiology and Public Health Methodology. But of course, under the umbrella of a Master of Statistics program. Then the Master of Statistical Bioinformatics was actually added to that, and the most recent development is an addition of a track called Data Science, where a lot of other people, non-statisticians, are contributing to what data science should be towards the future. Because a lot of people think they're doing data science, and for some that's true. For some that's scratching the surface of all the possibilities that are out there in terms of data science as such being a discipline. Data science is also a very broad name, so some people relate it to artificial intelligence, and of course there is a relationship to that, but it's not solely artificial intelligence, for instance. So I think what we're actually seeing on that level is the same as we've seen in the past in terms of statistical bioinformatics, that people need to define what the area is about. And I think that for nowadays, that's better known for bioinformatics, but not yet the case for data science. Something that we're very proud of on the right-hand side, you see the accreditation of the Royal Statistical Society. And actually, I should have put the updated accreditation certificate there, because this is the older one, but we have a few years ago, I think it's now 3 years ago, we got a new accreditation as such, which is very important. And it's a label of quality, a quality label that originates from the Royal Statistical Society of the UK, which is one of the oldest societies in statistics that are out there. And we have been the first program to receive such an accreditation. And we're still very proud that we nowadays still have this quality label. It's not so easy to get as such. There's a formal visitation and so on related to that. Therefore, it makes us, even more prouder, let's say. We have in our track, so we have 4 tracks as such, 2 years each, and we have both an on-campus version and a distance learning version of all the courses. This is something that was already in place before the pandemic actually emerged, but has been very beneficial at this moment in time, because we have a huge amount of experience already in distance learning, and that helped us a lot during this pandemic as well. But of course, we'd love to see our students on campus and not solely through a screen, let's say. So we hope we can return to that very quickly for those people following the on-campus version. And of course, the distance learning version is good to say that we have, in 2018, we celebrated the 1,000th student following the distance learning program. So for a very young program, because it was not initiated that much earlier, this has been very successful. In terms of employment of the graduates of our program, most people end up in the pharmaceutical industry, although that landscape is changing a little bit at least. But that is also, of course, related to the country we're in. We're in Belgium, and Belgium has quite a few very large pharmaceutical companies based here. And we have very strong ties, for instance, with Johnson & Johnson and GSK, but also with other companies. Of course, also universities, and I'll give you an example in just a moment of a very nice capacity building initiative that we took, and which actually resulted in a new Center for Statistics, but I'll come back to that in just a moment. So, but that brings me to indeed research institutes and governmental agencies. Good to know for those who are following the Master of Epidemiology, and it's also in the other way around, is that if you follow the Master of Epidemiology, there is a 1-year tailored program to follow the Master of Statistics at Hasselt, but also the other way around, so that you actually master both. And the difference between, and especially the quantitative epidemiology track, as it is now called, no longer epidemiology and public health, because we really wanted to emphasize basically the difference between the Master Epi program in Antwerp and the quantitative epidemiology track within the Master of Statistics and Data Science, is that we in Hasselt focus on the methods as such, and in Antwerp I think it's broader than that. Of course, it's still strong on methods in terms of the statistics courses, but in Hasselt we go even deeper into the statistical methodology there. To show you the on-campus, it's not the most recent map, but we produce these maps from time to time. And I'm sorry if for not producing a recent one, but this is basically where people on the on-campus program originate from. So it's very broad, and you clearly see that the connections are there, especially with countries that don't have a master themselves. And for some countries that do have a master, we support them. I'll come back to that in just a moment as well. But it's very broad in terms of the countries we are linked with. And then indeed come to the ICP Master of Statistics, for which I'm the promoter. And actually it was Paul Janssen, who has been a promoter for a very long period, and I took over a few years ago. And the focus of our ICP Master of Statistics, but that's very similar to Antwerp, of course, is a focus on building capacity in the south. And in Hasselt, we focus on specific countries, simply because you can't focus on all countries that are on the eligibility list. Let's say that those are 31 countries. That's a little bit too much to focus on all of them. But we... Right. There's a mic. Okay. We focus on institutional collaborations, which are very important. And these institutional collaborations are mostly part of the specific countries we're focusing on. That's, of course, also the strategy. And each of the professors at Hasselt University has a country of focus, let's say. That does not mean that professors do not share and so on. No, on the contrary, but it's like every professor has this very strong link to one of the countries at least, so that it's sustainable, and that we are basically sure that this will be an interest that will stick, let's say, for years to come. This is also translated to some extent in the selection of the scholarships. So our first criterion is, of course, quality, and it's an open competition for all the 31 countries. But then when we are selecting scholarships, we also pay particular attention to those countries we are focusing on. And the reason for that is indeed capacity building, because you can educate one person, but then that one person will be returning home, for instance, will be a singleton, to say it in mathematical terms. And therefore it's important not only to have a singleton, but have several people there that can actually establish new collaborations and actually establish also maybe new institutes and so on. Of course, now we have the North workshop, but we also have normally in normal times, let's say, we also have a South workshop. And we also deliver courses to the different countries we are collaborating with, so short courses, which is always a very nice experience, traveling and presenting a short course to many interested participants. Just to highlight 2 achievements before I'll wrap up. We have been founding master programs in countries outside Belgium. We have been helping out in Ethiopia, and there are different master programs now that have been established. We're still supporting that, and that's primarily the topic or the area that Sif Shkedi has worked on for many years already. But also other people have contributed to a large extent, also outside Hasselt University, with strong connections to our institute. For instance, also the master program in Havana, in Cuba, is also very important to us, and that's especially has been the work of Geert Mollenbergs, but a lot of former Cuban colleagues as well. And I think we all almost visited Havana to teach a course, for instance, there. There are many more, and we hope there are many more to come and to stay. But of course, building a master program, that's not something that you do overnight. It requires a lot of effort, and it requires that you have the capacity to do that. And so in that sense, I'd like to connect also to research and education. They go hand in hand. And well, actually 2 years ago, we've established the Center for Statistics at the Eduardo Mondlane University in Maputo, where one of our former PhD students is actually the head of that Center for Statistics. And there are still some PhD students finishing after they've done their Master of Statistics, or the ICP Master of Statistics. And another initiative that is nice to see, and in terms of connecting research to education, is also the revival of the International Biometric Society in the Uganda region, where Dan Kajunga is the chairperson. And also that is very important. The International Biometric Society is one of the largest societies in the research area of statistics and biostatistics. It's a very important society to us, high quality as well. And so we're very proud that we have contributed to the revival, let's say, of the Ugandan region International Biometric Society part. Just to wrap up here, I would like to thank you for your attention. And of course, managing a program like this is not possible if I wouldn't have Shella, who's actually taking the large burden of running this. So thanks to Shella as well, and many of people in Hasselt know her very well. And I hope you get to know some of the work and some of what we've done in the past today. Thank you much.
Thank you, Neil, and thank you, Jean-Pierre. It was a very comprehensive presentation about the master programs. All right.
Christopher?
Yes.
As I don't want to omit something because it was not on my slides, but most of you know Sylvie van den Branden, who is also, I think, online, and Christopher talked also, who are coordinating and following the administrative and all the logistic issues. So I should, to be for completeness, also thank those of you, two of you, for all the work you do on daily basis for this program. Next to all my colleagues, professors who are of course not online today, who make the MAPI happen. Okay, just so final because it was not on my slides. Okay.
Okay, thank you, Jean-Pierre. All right, I will just give a few instructions regarding the presentation. So we have 6 speakers, and each will talk for 15 minutes, and then we have 5 minutes questions after each presentation. So for the questions, please, I will ask you to raise the hand at the end of the presentation. There is a small hand in the lower bar of the screen. On something else, during the break, we'll have a break after presentations. I will ask you also to please fill in the online form, contact form that I just put here in the chat. So then we know who is attending this webinar. Okay, so the first speaker, I'm glad to present Veronica Masanga from Uganda. She's alumnus from the Master of Epidemiology, the years 2018-2020. And she's an advanced field epidemiology fellow in Uganda and working with the Uganda Ministry of Health. So, Veronica, can you hear me?
Yes, I can hear you. Kindly share the slides, please.
Yeah, yes, I will share your slides.
Thank you.
So, can you see the slides?
Yeah, sure.
Oh, wait, sorry. I want to mute myself. It's with. Okay, please.
Okay. Thank you, Christopher. Good afternoon, everyone. My name is Veronica Masanga, an alumnus, as I've been already introduced. I'm currently a fellow with the field epidemiology track at the Ministry of Health, working together with the US CDC, Makerere School of Public Health, and Ministry of Health here in Uganda. That is a brief of what I'm doing after my Master of Epidemiology that I just completed in 2020 at the University of Antwerp. Next, Christopher. Yeah, so I will briefly give you a profile about me right now, my academic path, my career path, some of the work I've been doing, and some future perspectives. Yeah, right now I'm a practicing field epidemiologist by virtue of the fact that I'm a fellow. This is a fellowship that was started by the US CDC in 1980, and with the main aim of training field epidemiologists in developing countries. So this was mainly to build capacity of epidemiologists in these countries in order to enable collection, analysis, and interpretation of disease information so that we can, based on evidence, to make recommendations for action and save lives. I'm also actively involved in research because I'm currently attached to the National TB and Leprosy Program here in Uganda. So I'm doing a lot of work in TB and leprosy, HIV, malaria, and some reproductive health. Some other responsibilities that I've taken on are, I'm a member of the National Health Task Force, also the National Rapid Response Team, and a member of the Palliative Care Association of Uganda. Next, please. That is briefly about my career. I did a diploma in clinical medicine, what in other countries are called paramedics. So I'm a paramedic. Then I did a Bachelor of Public Health at the International Health Sciences University here in Uganda. Then a Master of Public Health, which I'm winding up here at the Uganda Christian University, and a Master of Epidemiology that I concluded in 2020 at the University of Antwerp. Part of my employment as a young paramedic, I started working with the Chiboga District local government as a clinical officer, heading a Health Center 3. Then a few years later, I became a senior clinical officer, then left local government and joined an international organization that was working in community health, and that is Living Goods as a branch manager. Didn't take me long to get a promotion to a regional field manager, supervising a number of branches in different regions. That's when I joined my Master of Epidemiology program. That's why you find a slight gap in between my employment history. Immediately after the Master of Epidemiology, I joined the Field Epidemiology Fellowship Training Program here in Uganda at the Ministry of Health. And that I attribute to some of the benefits I got from the Master of Epidemiology at the University of Antwerp. The mentorship received, the skills, especially in data analysis. It is that uniqueness that sold me into this program, however competitive that it was. Next, please. So that is the team that I work with. It includes fellows, the secretariat, and our residential advisor from the CDC here in Uganda. And that was my first day. Yeah, that was my first day. So, yeah. So as part of my work at the University of Antwerp, I was able to, with the help of colleagues, my supervisor and my promoters, I was able to publish my master thesis. That is the trends and correlates of sexually transmitted infections among sexually active Ugandan female youths. Because of the encouragements received from the university, most of us were encouraged it would be good to publish. And for me, I'm happy to say that was my first publication, and yeah, it started me on a good journey that I'm headed for. So the recent work, I've been working with my team on a number of projects. My very first project was investigating a malaria outbreak in Iganga district here in Uganda, then investigating an insecticide-treated mosquito net ownership and utilization in Kaliro district. This was following a mass distribution of mosquito nets by the government of Uganda. So we wanted to go and see the ownership and how people are using them, because it is one thing having the nets and another thing using them correctly. Then I'm a national trainer for the catch-up campaign for accelerated TB response for finding missing people with TB. This was born as a result of the impact of COVID-19 on TB-related services. Because of access, there was a very long lockdown here in Uganda, so there was very low access to services, and it affected continuity and also initiation of patients. So there was funding from Global Fund that was put across with a recommendation to hold a catch-up campaign to see if we can find these missing people with TB, and I happen to be a national trainer on that team. We all know there is ongoing vaccination in different parts of the world of COVID-19, and we have seen on social media a lot of conflicting information. So we as epidemiologists or scientists have to come up and make correct some of that information so that we can see our people embrace the vaccination. So I am one of the people that are involved in that vaccination campaign. Because from the information, from the knowledge I gained from my MEPI program, and what I was able to successfully write my first grant on respectful motherhood, and I'm glad I did that. So I also have some ongoing work investigating malaria deaths in 8 districts. When we look at the data, here at the program, we mostly use DHIS2 data, that is the national data that is fed in by different health facilities in the country. So we found a very high number of deaths in some of these districts. So we set out to go and investigate why these deaths are happening at this time. And we are looking at the burden and determinants of latent and active TB infections among inmates in Uganda prisons. I happen to be leading the project, starting with a protocol writing, which has been completed and submitted to the CDC for review. For the campaign that I just talked about, I am heading the assessment of the impact of the catch-up. We want to see if the campaign has been successful in attaining the set targets of finding the missing people with TB, and I am leading that because it's already ongoing. Next, please. More still, we are evaluating the expert MTB RIF ultra test guidelines. We all know there are guidelines that have been set for TB diagnosis using the very sensitive ultra test. So we want to assess adherence to those guidelines and also see if there are any differences in outcomes for the culture and TB results for the trace patients that are having two results. Because when a patient is found with a trace result, you do another test to confirm, and that's what you use for the test. So we want to see if there are any differences in the initial and final tests. I'm also doing a descriptive analysis, more like profiling the trends in TB treatment outcomes between 2016 and 2020 here in Uganda using DHIS2 data, and also looking at the trends and determinants of missing TB cases in Uganda, still analyzing DHIS2 data. So like I talked about, this is a brief one about the malaria outbreak that we did here in Iganga district. And just to give you a brief history of how we came to determine there was an outbreak. That is my team setting off for our first field investigation. We all know malaria is highly endemic here in Uganda and responsible for 30 to 50% outpatient visits, mostly affecting children under 5 years and pregnant women, and their seasonal patterns, so they vary with seasons. Yeah. Why we went out to study to carry out this study in Iganga district, we received an alert from DHIS2 data on 25th of February. So the way we find those alerts is we run malaria data for a given period of time, and then we use what we call the malaria normal channels, that then we find which districts are mostly affected and how much more the cases are beyond the threshold or the expected numbers, and that's when we determine if there is actually an outbreak. So we identified an outbreak in Iganga district, which is in the eastern region of Uganda. We calculated attack rates to identify the most affected sub-counties in Iganga district, because we couldn't conduct a study in the entire district due to resources. And the outbreak investigation began on the 1st of March, 2021. Yeah, from our malaria channels, that is what we do. We calculate the percentiles and see where the highest peaks are to determine which period we shall be investigating in our field investigation. So from this, we can see where the outbreak started, where the highest peak was, and how it progressed over time, and where we started our outbreak investigation. So where we started our outbreak investigation is where we received an alert that there was actually an outbreak for a given period of time in Iganga district that had been consistent. And that triggered the decision to go for the investigation. Next, please. So that is a brief map of Iganga district here with the sub-counties that we looked at for us to calculate the attack rates and end up with one sub-county for investigation. And this is the sub-county that we went to for investigation. It was a full sub-county, but we didn't do the entire sub-county, so we still went ahead to calculate the attack rates for the different villages, parishes and villages in the sub-county to end up with the most affected for us to focus our investigation. So the objectives, we wanted to determine the scope and magnitude of the outbreak in Nabitende sub-county and identify the exposures associated with the malaria cases, because we know malaria is endemic in Uganda and we expect cases throughout the year, but we wanted to know what changed in these communities that led to these spikes in the number of malaria cases. And like I said earlier, with this fellowship, we aim at making evidence-based recommendations for action. So that is one of our objectives. We used the case control study design, and the population were individuals living in Nabitende sub-county between May 2020 and February 2021. That is, May is where the spikes started. That is why we considered that period. And February is when we detected the alert. So our case was defined as any positive malaria test result using the RDT or microscopy between that study period in the residents of Nabitende sub-county. Sorry, that is 2021, not 2020, not 2022. So we are, let's go. So what we did was do line listing. So we did a record review from all health facilities reporting to DHIS2 with the aim of line listing our patients, the cases that we had defined. And in there, we collected demographics, age, sex, village, parish. We looked at the lab confirmation, was it a BS or RDT or we left out the clinical, the dates of diagnosis, and the name of the health facility for comparison reasons. Next, please. So before we generated our hypothesis, we first went out to the field to try and see some of the changes that happened in the community that could have triggered these spikes in numbers. So we had some discussions with in charges of the health facilities. We met community leaders. We met community members. We went for environmental assessment, like you can see in the picture, trying to look for some mosquito larvae, closeness of homes to farm fields, occupations related to breeding sites like bricklaying and what that leaves ditches around. So we went and did all that assessment before we could come up with what are some of the factors that we would include. Next, please. We selected the 3 most affected parishes in Nabitende sub-county. And from those parishes, we still selected 5 villages with the highest attack rates from the 3 parishes. The households selected, we used from the villages that we selected, to select the households, we used simple random sampling. We had a list of households provided by VHTs or LC1s from which we randomly selected the households using Excel random function. Next, please. So the households we visited, we inquired about malaria in the household member during that period for us to select the actual participants. And from each household, we selected at least 1 case. For households with no cases, we used that as a control. And if there was more than 1 case or more than 1 control, we selected 1 using random sampling by using the first name alphabetic. So we analyzed proportions, we did attack rates, we drew some maps and epicurves, and logistic regression for factors associated with malaria. And all this was used in EpiInfo. It is the program that we mostly use as a fellowship. So those are the cases that we found from that period, and the attack rate for Nabitende sub-county was 15.9%. Next, please. Click, please. Yeah, so those were the most affected villages after calculation of attack rates. So those are the villages that we focused on for our investigation. And for the risk factors, we found the odds ratios. Kindly click so that we can see the most affected. Yeah, and we found that the most recent political campaigns, because we had lockdown, so people were not allowed to hold campaigns. People were sneaking in the nights to hold small rallies. So there was a lot of exposure to mosquitoes in the nights. Then the waterlogged places, because of the COVID-19, most people lost jobs. So many people went back home to do activities like bricklaying and rice growing. So there was a lot of waterlogging around households. Then the households that were close to swamps and the distance was less than 500 meters, and also distance from the rice fields that was less than 500 meters were some of the exposures that we found in the communities. Next, please. So those are the factors that I have already mentioned. Next. So we made some recommendations. We realized that we discovered this outbreak quite late, and that is because the districts don't know how to use the malaria channels for early outbreak detection. So we advised that districts be trained in use of malaria channels for early detection. Then mass distribution of treated mosquito nets, because the last had been distributed in 2017. And then also periodic evaluation of the nets, how they are used in the communities. We found some that were using them for fishing, for catching white ants and all that. Yeah, along the journey, both academic and career, there is family. I am a mother first before I'm an epidemiologist. We meet obstacles on the way with field work. You cannot know what you're going to meet on the way, but you have to push on. We don't only focus on the bad, we also find some hospitality in the communities that we go to. They give us some eats, we play around, and then there is teamwork above all, who is doing what, because with epidemiology or with science, you cannot achieve alone. So you need to work as a team. Next, please. Yeah, to my colleagues, especially those that are in first year, second year, or aspiring to join the programs, there are opportunities out there, but it depends on how you package yourself, your skill. How do you stand out? Because everyone else is grumbling for those opportunities. So how do you sell yourself? What makes you stand out? The quest for knowledge. With the evolving nature of science and the world, you cannot stick to just what you have learned yesterday. You have to keep pursuing knowledge. Then the opportunities will never find you seated where you are. You pursue them. Then you have to build networks. It is really, really important to build networks. Networks take you places that you never imagined you would. But above all, our footprints. Let's leave our footprint in the field of science. Thank you for listening.
Your mic is off, Christopher.
So I was talking. So sorry. So we will leave the questions for later, Veronica. Thank you very much. Because now we are running a bit late of time. So our second speaker will be Edmund Jerome Jaggi from Kenya. He's alumnus from the Master of Statistics from the years 2007-2009. And currently he's assistant professor in biostatistics at the London School of Hygiene and Tropical Medicine. So Edmund, do you hear me? Can you share your screen, please? Edmund?
Hello, can you hear me, Christopher?
Yes, we hear you.
Okay, good.
Maybe you can share your screen.
No.
In the lower bar, there is a button present now.
Yes, I need to. It's the window. Okay, I have it now. There it is.
Yes, we see your screen.
Okay, cool. Sorry about that. So first of all, thank you very much to the organizers of this workshop for extending the invitation for me to come and speak. I'm going to very briefly talk about my current research activities here in London, and also my teaching activities around Europe. And then, so very briefly, and then focus on the small things that I'm doing and that I've been doing to try to build strengthen capacity in biostatistics in sub-Saharan Africa. As Christopher has mentioned, I'm an assistant professor at the London School of Hygiene and Tropical Medicine. I'm an alumnus of the Master of Statistics at Hasselt. I also did my PhD in statistics at University at Hasselt and my postdoc at the same university. In terms of my current research, I'm based within the Inequalities in Cancer Outcomes Network, which is a research group at the London School of Hygiene and Tropical Medicine. And what we do is to study inequalities in cancer care and cancer outcomes in England. In terms of how we do that, we use data from different sources. We use what is called population-based cancer registry data, but also what we call primary care data and secondary care data. The evidence that we generate from what we do is crucial because then policymakers can use this to formulate targeted interventions to ensure that improvements in cancer care are experienced by all the people in England. So to ensure that there are no inequalities in cancer care. For the statisticians, in terms of what are the statistical methods that we use, we use first of all, for instance, spatial time to event analysis methods called excess hazard models. They are a complex analysis approach for analyzing population-based time to event data, because there are some complexities of the data setting that make it that invalidate classical survival analysis methods. We also have to deal with missing data in important prognostic variables such as stage at diagnosis. And in particular, we do find missing data problems in which it's quite tricky, quite complicated to assure what we call compatibility between the imputation model and the substantive model, or what we call the analysis model. And therefore, some of the methods we use include what we call substantive model compatible multiple imputation techniques. Apart from that, I'm currently working on a project where I'm using what we call high dimensional joint models for analyzing multiple longitudinal outcomes. When these multiple longitudinal outcomes are quite many, meaning that you do get it becomes quite complex in terms of implementing joint models. So that's a very brief overview of what I do in terms of research. For those who are interested, you can check our website. Just check Inequalities in Cancer Outcomes Network, London School of Hygiene and Tropical Medicine. Or if you'd like to discuss further, you can drop me an email via the email address that I've provided here. At the school, we have an MSc in Medical Statistics, a one-year MSc in Medical Statistics, and I teach what is called Advanced Statistical Modeling towards the end of the MSc. Apart from teaching at the school, there is a summer school called the Corsican Summer School on Modern Methods in Biostatistics and Epidemiology, which is organized every 2 years in Corsica, France. So in 2017, 2019, unfortunately this year I don't think it's going to happen because of the situation, but I've been an invited lecturer for this summer school to talk about how to handle missing data in cancer epidemiology. Now moving into the various small steps that I have taken and I continue to take to ensure that as a recipient of the ICP scholarship, I try to magnify its impact. One of the things, sorry about that. Can you see my screen?
Yes.
Okay, sorry. One of the things that I've done is that during my postdoc at University of Hasselt, together with colleagues at the university, we worked jointly with colleagues at the University of Nairobi School of Mathematics and other colleagues at the Jomo Kenyatta University of Agriculture and Technology in Kenya. And we developed a proposal for capacity building in biostatistics, which was submitted to the Flemish Inter-University Council. In the context of that project, I was a named collaborator, and we were successful in that grant application. In the context of that project, there were a number of things that were planned. One of them was to train a number of PhD students in biostatistics. So a number of students are from Kenya. And in terms of my involvement, I have been co-supervising one of the students who is jointly registered to University of Hasselt and the Jomo Kenyatta University of Agriculture and Technology. Apart from that, in 2018, I taught a 1-week short course on longitudinal joint modeling at the University of Nairobi School of Mathematics. We had around 100 researchers, lecturers, PhD students attending the short course. The feedback was, people are very enthusiastic about the short course, the content of the short course, the delivery of the short course, and arising from that short course, over time I've had interactions with different researchers who are quite keen, so researchers from Kenya who are quite keen on using, joint models, doing research using these types of techniques. In addition to that, in 2019, I submitted an application to the International Society for Clinical Biostatistics for some funding to organize a short course on the spatial survival analysis techniques. I did mention that when analyzing population-based time-to-event data, we don't use the classical time-to-event analysis methods. So I applied for funding to organize a short course on these spatial analysis techniques, to organize this at the University of Nairobi School of Mathematics. And I got some part funding, which helped to organize this short course. So 2 lecturers from the London School of Hygiene and Tropical Medicine went down to the University of Nairobi and taught the short course, where we around 70 people attended, and the response was again very encouraging. People were really happy with the content and the delivery, and many of them were quite keen on how these methods, for instance, can be used perhaps in their own research. In addition to that, last year, because I've been maintaining quite some close contact with the University of Nairobi School of Mathematics, colleagues from that school. They were working on a grant proposal jointly with the University of Nairobi Institute of Tropical and Infectious Diseases and other departments within the university and other universities as well. They were developing a proposal on COVID-19, which they were planning to submit to the National Research Fund in Kenya. And so they reached out to us. It's people that I've already worked with. I continue maintaining a collaborative environment with them. And from the London School side, we contributed to that proposal in terms of our expertise in statistical and mathematical modeling. And I'm happy to say that the proposal has been shortlisted by the National Research Fund, and we are hoping that it's going to be successful in the next few stages, and then the study can kick off in Kenya. Apart from that, there are a number of other small things that I continue to do. For instance, I give regular career talks at the University of Nairobi School of Mathematics. I do go there, or for instance, last year, I did it online via Zoom. I talked to the students who are doing their BSc in mathematics, BSc in statistics, about what biostatistics is all about, biostatistics and medical statistics. And whereas it's just a small thing, it has had quite a massive impact, because I do tend to see students reaching out, saying that they're happy to learn about biostatistics. Some of them go on to apply for scholarships. And for instance, already 2 of the students that have attended some of my talks, I think in the previous, two or 3 years, have been successful in getting scholarships to study medical statistics here in the UK. And therefore, that has also had some impact, whereas it's just a small thing. I'm also quite committed to collaborate whenever I can, as time allows. And recently, there's a student from the University of Nairobi School of Mathematics. They have got a master's program in biometry, and a student was doing his project, and he was interested in using longitudinal joint models for longitudinal time to event data. He reached out to me. I was happy to collaborate with the supervisors. When I had a chat with the student, I noted that he was quite keen on this topic, whereas he's quite advanced. He sounded quite an enthusiastic and hardworking student. I was able to supervise him, and he recently finished his MSc project, did some very nice work. In addition to this, there is an ongoing, perhaps it has concluded, I'm not very sure, but there is a capacity building initiative called the Sub-Saharan Africa Consortium for Advanced Biostatistics Training. And a couple of years ago, I was invited to be involved in its activities, and I was happy to do that. In the context of that particular capacity building initiative, one of the things that I've done is to supervise a PhD student who is doing a PhD in biostatistics at the University of Nairobi School of Mathematics. By the way, the student is also an alumnus of the University Hassot Master of Statistics program. The student is working on missing data problems, in particular sensitivity analysis when you have missing covariates, and in particular when the data are clustered, so hierarchical data, but also working on high dimensional joint modeling problems. And the application area that she's focusing on is inpatient pediatric pneumonia quality of care studies in Kenya. The student has done tremendously well. She already has peer-reviewed publications in journals such as Statistical Methods in Medical Research and Journal of Applied Statistics. For the statisticians, you do know that these are really nice journals to publish in. So she has done tremendously well. And this demonstrates that the ICP alumni continue to do exceptionally well out there. She has finished her thesis, and she's awaiting her defense. Finally, within the same initiative, in the 2017-18 and 2018-2019 academic years, I was invited to teach the longitudinal data analysis module for the MSc in Biostatistics at Stellenbosch University in Cape Town. I was happy to do that. I, developed the material, and then I would fly down to Cape Town twice a year, so in February and April, for intensive one-week blocks, so teaching the students face-to-face. And then when I come back to London, I would have virtual meetings with them to touch base, see how things are going. And in both years, the students were really enthusiastic about the module. They did very well in the assignments, and very many of them were inspired to consider longitudinal data analysis, joint modeling as well, because there was a topic on joint modeling as well in the module, to consider this as work that they could do further post-MSc. The students were from a variety of countries, some from South Africa, others from Zimbabwe, others from Namibia, and therefore that initiative built capacity quite in a number of countries. In terms of, for those who would like to talk more, get in touch, you can find my email address, read a little bit more about the work that I do on our university website, which I've provided there. But also you could reach out on LinkedIn. My LinkedIn name is Jaggi, PhD, and then we can talk more. LinkedIn, perhaps I should have mentioned this as well. Whereas it's just a social media tool, I find that you are also able to build capacity by interacting there as well, because sometimes when I'm going to give a talk, or sometimes when I have a new publication, then I post it on LinkedIn. Then sometimes I do tend to see students, for instance, from Kenya, who are doing their BScs, reaching out, telling me, I would be interested to know more about what biostatistics is all about. And then whenever I have time, I respond, we chat a little bit. And sometimes the students are inspired to go on and apply for MSc programs. And sometimes, even if, say, a student is not able to get a scholarship, sometimes I remember talking to one of the students who applied for a scholarship. She wasn't able to get a scholarship. But then I mentioned about the fact that the University of Master of Statistics has also started a distance learning option, a blended learning option, which is also quite affordable. And I was surprised that she took that quite seriously and enrolled for that program. And that's also, I think, a way of continuing to build capacity. So to the students who are doing their programs at the moment through the ICP program, it's just to encourage you that there are many ways in which you can continue to contribute to capacity building, to magnify the impact of the ICP program. even by raising awareness about biostatistics using social media. So there are many ways in which you can continue contributing. I'm going to stop there and once again thank the organizers for the invitation to this workshop.
Thank you very much, Edmund. Again, a very interesting presentation. I would like also to skip the questions for later, as we are a bit late on the schedule. So our third speaker is Damaso Kajenge from Uganda. He's alumnus also from the Master of Statistics from the years 2007 and 2009. And currently he's a program leader of data measurement and evaluation and a research scientist in Nairobi, Kenya. So I give the floor to Damaso. Damaso, do you hear us?
Yes, I can hear you. I've shared my screen. Are you able to see it?
Yes, we see it. Please.
Okay.
The floor is yours.
All right. Thank you so much, Chris. Yeah, like you've mentioned, Chris, my name is Damaso Kajenge, and today I'm going to talk a little bit about the politics of fundraising. I raised this topic because I thought that the statistician, sometimes we either sometimes do not appreciate the capacity that we have, or we've been raised to think that we are supposed to be support staff. So as a word of introduction, yes, Damaso Kajenge, I was at UHASART in 2007 and 2009. And then thereafter, I did my work, my PhD at KU Leuven. So in terms of what I'm just going to talk about, just give you a little bit about me since graduation from my master, and then about my present work. And then I would just touch a little bit on funding for public health research, my experiences basically, and then I give some tips and then talk about some few areas of my interest as well. So yeah, so since 2009, I went on to go to KU Leuven and I did my PhD in applied statistics. And
sorry, Trevor, to interrupt, but your slide is frozen.
Oh, sorry about that. Is it moving now?
Maybe you can put it in the presentation mode.
Okay, just a moment. I stopped sharing.
Yes.
Okay. I will share again. Yeah, thank you for alerting me. But see the presentation now?
Yes. Could you maybe launch the presentation mode now? We see the PowerPoint.
I have moved the presentation mode. Is it okay now? Chris, are you able to see the presentation?
Damaso, we have some problems to hear you. Do you hear me well?
I can hear you.
Okay. So you can just land in the lower bar. There is a button for the presentation mode. Otherwise, you can press F5. No. Okay. You stopped the sharing.
Yeah, because I just want to use the PDF. Perhaps the PowerPoint is not working. So let me try to the PDF.
Yeah, can do
that. Just sorry about that. Let me try the PDF. Perhaps that would be a bit better. Okay. So let me try again. I will go to presentation mode and share my window. And then I will try to share the PDF. Chris, are you able to see that?
Yes. Yes.
Is that better?
Yes. Yes, it's better. Thank you.
Okay. All right. So thank you so very much. So yeah, and I will not repeat this, but I just mentioned that I'll talk a little bit about myself since graduation, talk about my present work, and talk a little bit about what I have learned in public health research, specifically with a focus on my experiences with respect to funding, and with a focus on the role of a statistician, or where we belong, or what we needed to do as statisticians in terms of attracting funding for statisticians in public health research. And then I will offer some few tips, and then briefly talk about my other areas of interest. So Chris, you let me know if the slides are moving. So since 2009, I have done my PhD. I did my PhD in applied statistics at KU Leuven. And immediately after graduation, actually it was a little bit before I graduated, I was recruited as an epidemiologist. Now I've put up this slide mainly to show you can see a few highlights that I've given there to show that like some sort of a how diverse somebody from UHASLT or from the ICP program can be. Because immediately after, just before my PhD, I was recruited as an epidemiologist, but with a major emphasis on implementation science research in public health. This was at the US Center for Disease Control and Prevention. At that moment, it was a bit, even when I applied for this position, I was so sure that I would be mainly because at that particular moment, I knew I was a real statistician, and now I was applying for a position in epidemiology. But when I was interviewed, I just found that the questions were really relevant to what we had learned from the program, especially at UHASLT. And then, so why I mention this is that sometimes most of us tend to restrict ourselves to the word statistics. And maybe we think we cannot deliver or we cannot perform very well in other areas, especially like epidemiology. And I'm really very happy that this workshop is focusing on both, on all programs of ICP. So there are lots of interactions within for epidemiologists and the statisticians, especially when it comes to public health research. Thereafter, I did teach at 2 universities in Uganda, and that was at Malaria University of Science and Technology, as well as Makerere University, Kampala, Uganda, where I served as a senior lecturer for epidemiology and biostatistics. So I was teaching epidemiology and biostatistics at Malaria University of Science and Technology, while also teaching statistical methods at Makerere University, School of Statistics and Planning. And in between there, I was able to, I went to Sweden at Karolinska Institute as a fellow in biostatistics, and also went to UC Berkeley in the US as an impact evaluation methodologist. So that was also a fellowship. Now, immediately after my fellowship at UC Berkeley, I came back to East Africa and immediately headed to Kenya, where I was recruited as the head of data measurement and evaluation. And this was at the African Population and Health Research Center. So just briefly, that is how my career has spanned since 2009. But also to mention that in between there, I have done quite a number of consultancies and teaching and short courses, and I will talk about those very briefly later. Since 2009, I've also been able to publish over 30 peer-reviewed publications in high-impact journals, and I've also authored over 10 technical research reports, blogs, and policy briefs. So the last line there, I show that since, I think this is actually since I graduated from my PhD, I have also been able to raise about $3.5 million US in research support as a lead of projects or as a co-lead, a PI or a lead. And then I have also been able to raise about $15 million US collaboratively. So collaboratively here I mean either as a co-investigator or as a statistician, but at least I have been in those projects where I am proactively involved in the writing of the research grant. So basically that is about my profile. Now, just very briefly, at APHRC, we operate in over 20 countries in sub-Saharan Africa. So this map is for 2020. I think right now we should be in about 25 countries. We have our offices in Nairobi and we have another office in Senegal. Then our work is basically to generate research evidence, strengthen research capacity, and engage policy to inform action, population health, and well-being. And our mission basically is to use evidence to impact and transform lives in Africa. So this evidence that is obtained through research. And now this one here, Chris, can you let me know if you are still with me?
Yes, I hear you.
Thank you. Yeah, so what I'm showing here, I just really wanted to show, back to what I mentioned at the beginning, the power of a statistician or the power of an epidemiologist, if I can use that word. But I just want to focus on statistics here, mainly because I graduated as a statistician. So as you can see here, you will note that at APHRC, which is really a premier research institution in Africa, APHRC boasts of about 180 staff. And of these 180 staff, about 70, between 60 and 70, I don't have the statistics right now, but as of at the end of 2020, 65 of the 180 staff were PhD holders. And these PhD holders, they just come from across different parts of the continent, mostly from Africa. And they also cover a number of disciplines. So demographers, epidemiologists, medical doctors, in different areas, people who are focusing on education and etc. So what we have here, we have 4 divisions. We have the division of research, we have the division of research capacity strengthening, and we have the division on policy engagement and communication, and then lastly we have another division called operations. But I wanted to focus here, which is the research division actually has about 80%, or the research division is about 80% of the entire of APHRC as an institution. So the department or the unit that I lead here is called data measurement and evaluation, and our job is to support all these 6 research programs or departments, as you may want to call them. But we also offer support to research capacity strengthening, especially in the context of monitoring and evaluation. And we also support the policy engagement and communication also in terms of monitoring and evaluation. The program that we do not support so much is this one on operations. So this is really the strength that we have here at APHRC. And this is what the areas that I lead on, that my team, I have a team of about 40 staff. And these 40 staff are clustered in these 3 areas. One is on surveillance and evaluations, where we have evaluation specialists. We have some research officers actually, but these research officers are actually focusing on data and not necessarily the usual research. So I have a project under my unit called the Health Demographic Surveillance System. So we have a project manager there, and we have some community liaison officers and the field staff. Then we have another sub-unit called the Robust Data Systems, where we have software developers. So these are data systems developers, people who deal with some SQL and development of data entry screens and etc. So we have some data managers there that focus on quality assurance and quality control, and we have some data scientists there that are focusing on data visualizations and data mining and etc. And then we have also another team that focuses on that has data analysts and statisticians. Now, that is about APHRC and what I do. So here, I really wanted to show that in public health, research funding is awarded via a competitive or merit-based process, and this is really not news. And what I have learned so far is that not all people that apply for funding are actually funded. At APHRC, our success rate is about 11%. So in a year, we write about, I told you we are about 65 PhD holders, and each of these PhD holders, at least in a year, writes quite a number of, as a read, of proposals for funding. And we respond to requests for proposals, etc., etc. Our success rate is about 11%. That means when we write about 100 proposals in a year, only 11 will be funded. So that is how serious this work can be. But I'm showing why I put this picture here, which I got from CDC here, is to show that this is like 2012. It shows that when you look at these areas here that usually attract funding, you are not going to see their statistics. Here, you will not see that. So these are different disciplines or different diseases, etc., etc. So now the question is, then where do you find yourself? And this is the question I used to ask myself when I joined HRC, even when I was still teaching. Now, that's what I mentioned. Some funding is allocated according to preset formula or priority areas, maybe because of the severity of the disease. Right now, a lot of funding is going with HIV and COVID-19, etc., etc., and malaria, and of course, like that. So the question is, as a statistician, where are you? Statistics is basically a profession, so now how do we go about it? And then also, some awards can be made directly to government health departments at all levels. They can be made to non-profits, academia, businesses, etc., etc., but sometimes also to individuals. What I am showing here in this picture is the way funding has been given to APHRC, like across the different research units that I showed. So in 2014, as you can see here, this small blue bar is for the data and the statistics, the unit that I read. As you can see here, you will see that a lot of funding is going to health systems, a lot of funding is going to reproductive health, a lot of data funding is going to education and youth empowerment. And then, of course, the green one, which is about aging, you can see is also there struggling to the data and the statistics. So what I mean by the data and the statistics, this is funding that comes directly to us as a unit, as a department. And although we contribute and we support all other these other units that I mentioned before, but we also go ahead and solicit funding on our own. So for instance, to support governmental departments to set up their statistics units, to conduct some visualization, some data visualization. The gray one with the maternal and child health was not part of the units at APHRC in 2014, 2015, and 2016. And even when it started around 2017, but you can see, even when it came in 2017, it immediately surpassed the data and statistics. As you can see, it was data was okay. Then in 2018 it went up, 2019 it went up, and 2020 it went up. So, but as I put there a small trend line to show you that even for us, for our data and statistics, we've been growing over the years. So the idea organizations and funding agencies from my own research that we dedicate money and funding to data and statistics. Most of the time, they are part and parcel of the other research units, and if you keep it in, that mode, then you are swallowed up by these other disciplines. So in this slide here, I have just put up just a sample of the ones where we are the ones who are reading as data and statistics, not necessarily as part and parcel of the other research units. So I mentioned earlier that in my own capacity, ever since joining the PHRC, I've been able to raise about 3.5 million as the aid, but also about 15 million. Here I'm focusing on the 15 million where I've been providing research support to other units. But this is where we've decided, I talked to my team members and I said, guys, we can also go ahead and get this funding and also put our names on the funding map. So if maybe just to mention like one or two. So for instance, we received about $4 million with my colleague who is based in Senegal, and my colleague here on setting up, we have set up a regional testing hub for strengthening subnational data systems in sub-Saharan Africa. This project funded by Bill and Melinda Gates is to be implemented in 6 countries 4 countries in West Africa and 2 countries in East Africa. This was awarded at the beginning of this year. The other one, as an example one, is the most recent one, which is focusing on building a data hub and applying artificial intelligence and data science to support public health and economic decision making in Kenya and Malawi. So this is about heterogeneous, harnessing heterogeneous COVID-19 data. Related to this one here, I collaborated with the UCL and the ICRW, so that is UCL, University College London, to set up a database for gender disaggregated data for COVID-19. Also received the funding of about 600,000 from the Gates Foundation. So these are just examples. They like to go out and say, okay, can we be the ones to lead the evaluation?
Damaso?
Yes.
We don't hear you anymore. Do you hear me?
Yeah.
Yeah, we are having some troubles to hear you. Also, maybe if you can wrap up in the next 2 minutes, please.
Let me know if you can hear me, Chris.
Yes, now I can hear you.
Okay. So I don't know where you lost me, but I was just finishing up.
Okay.
Yeah, I was
yes,
just finishing up.
We had some troubles. Yes, please.
Okay. I was just finishing up with a few tips here. That one of the ways to make these achievements is to define a niche. So you've got to brand yourself, e.g. through peer publications, through teaching, and through writing some. Ready to collaborate with and some collaborators across different parts of the world. I need to be part of a community of practice. So, for instance, belong to national and regional professional bodies. And then, of course, I've already mentioned, like, you need to take initiative to read, to reach out to funding agencies without necessarily waiting for the subject matter experts to hold you at some point. You need to take a read. And I do is, this is something that I also do in order to continue branding myself, that I am involved in teaching at doctoral and undergraduate, and I also participate in professional development courses. So quite a number there that I teach within the East African region. So yeah, so that's all that I wanted to share with you today. And thank you very much for listening about the issue. What to you, Chris?
Thank you very much, Damaso. Indeed, quite relevant what you have mentioned about funding. I would like to invite you to also to wait for the end for the questions, just to get on track with the schedule, please. So now our fourth speaker, Catherine Atahingwa from Uganda. She's alumnus from the Master of Epidemiology, years 2017 and 2009, and currently she's working as an epidemiologist and survey leader within a private company in Uganda. Catherine, do you hear me?
Yes, I hear you, Christopher. Do you hear me?
Yes, I hear you. I will share
you hear
your. Yes, Catherine, I can hear you. I will share it. Do you want me to share your presentation,
Okay,
right?
Yes, please.
Okay. Okay, Catherine, please.
Okay. Thank you so much, Christopher. For the organization. Good afternoon, everyone. My name is Catherine. My presentation today, I'm going to talk about I want to talk about myself and what exactly I'm involved in currently, and also kind of give a brief background of my journey at University of Antwerp, and also a few tips to my colleagues who are currently doing Masters of Epidemiology from University of Antwerp. Next slide, please, Christopher. So my education background, I did Bachelor of Science in Public Health from the International University, Kampala here. Then I also went ahead and did my Master's of Epidemiology from University of Antwerp. At the moment, currently right now, I'm working as a field director for a project which is being implemented by University of San Francisco in collaboration with Missouri University, whereby they're looking at creating social support groups for the integration of empowerment of formerly abducted women in northern Uganda. The experiment project is basically to estimate the impact of the program structured around support groups and individual goal setting on the achievement of empowerment-related objectives, that is, economic outcomes, aspirations, and integration for women who have formally experienced abduction. And at the same time, I also work as a survey lead for Alpha Statistical Consulting Limited in Uganda, whereby I take on most of the projects. What we do here is we apply for consultancies, and when they are awarded, I normally take the lead. Next. So my journey at University of Antwerp. So before I got the scholarship of the master scholarship of epidemiology, I had just finished my bachelor of science in public health, and at that time I being mentored by Dr. Edmund, who was a previous speaker. So that time he was my mentor, so we used to work together at Malaria University, whereby I used to host in some of the projects that we were putting on, and I also took part as a research assistant in some of the projects that we did work on. So I remember before I applied for the scholarship, in that time around in Uganda, there was of course this web where everyone was applying for Masters of Public Health, and it's something which I really didn't want, because I'd already done Bachelors of Public Health, and I wanted a Master's whereby I could be unique, I could stand out. So during that time, I got involved in various projects, one of which was on TB, and another one for my bachelor's work, I kind of looked at preterm birth in Uganda, which are some of the motivations that really led me to kind of delve into epidemiology. So, of course, through mentorship with Dr. Damas, we were able to apply. I was able to apply for Masters of Epidemiology, which of course I was awarded, and I'm so grateful that I really took on this field. So when I went to University of Antwerp, of course, being my first time there, the environment, of course, was kind of new to me, but of course, it was something to learn from. So, I remember in my class we had students from diverse backgrounds, and of course, some were doctors, some were statisticians who had already done statistics, etc. And what I learned is when working and learning with people from a variety of backgrounds and cultures in class, normally you're able to gain more comprehensive understanding of the subject matter, and you also learn, you as a student, how to use your own strength and point of view to contribute to various stuff that you're working on, which I found myself that during that time when I was doing this master's, it kind of somehow helps me to be able to achieve achieve deadlines, to do my coursework on time, or something like that. And then the other thing is teamwork. Teamwork really kind of helps me out. We're able to create a first teamwork among ourselves, and also making friends with the professors and also with other students. This also really played a big uh, uh, during studying epidemiology at Antwerp. So at the end of course, I graduated in 2019. I was able to graduate, and during this, I was able to publish my master thesis, which was on trends and determinants of health facility delivery service utilization among mothers giving birth in urban slums of Nairobi. For which the data I got data from African Population Health Research Center under the mentorship of Dr. Edmund. And also together with him, we were able to publish another paper on effects of women's intra-household bargaining power on postnatal and infant health care in rural Uganda. What one can see from this paper is
Your mic is off, Christopher.
Oh,
is
sorry.
that
Yes, I was saying that there is a lot.
it has been
Yes, there is a lot of noise background, so it's a bit difficult to hear you. Is it possible to change to other room? Or Catherine?
next slide.
Okay.
Next slide, please. So about this slide basically is to give tips to current students who are pursuing Masters of Epidemiology and also other courses. So of course, when you graduate when you finish school, basically you find professional opportunities. For example, in epidemiology,
Catherine?
you can join academic or research. You can go work for an government institution, for example, Minister, or you can join NGOs.
Catherine, the connection is not stable. Cannot hear you.
From abroad. I think like when you come back home, is able to compete with the other men.
Catherine, it's a bit difficult to hear you. The connection is not very well, I think. Do you hear me?
Can you hear me now?
Yes, I hear you.
Yes, I can hear you.
Okay.
Yeah. I was talking about professional opportunities for epidemiologists. So like I've outlined that we have academia, government, NGOs, and medical practice. The opportunities are there is how you package yourself to come and stand out with your other peers that you apply with when you come back home is what should make you unique. And also when you're studying your master courses, during this course you develop a lot of qualities and abilities, and of which they keep on adding more and more and more. But what you should know is most of the field of employment and what it's often the skills that set you apart than the subject specific knowledge that you may have gained in class. So and these skills most importantly they include something like critical thinking, so ability to analyze and ability to work independently and ability to motivate others. So if you're able to ascertain those skills, then you should be able to fit in fit in the world after school. Then the other point is networking. Networking, like how the previous speakers have mentioned, is really important. For example, I can give an example about myself. In most of the current positions I'm holding is because of networking and collaboration that I happen to get them. So try as much as to make connections and networks wherever you are, because this one will play a very important role in your next step after school. Then the other thing someone can dive into is doing a PhD, because it does not stop on the masters. You can still continue and you do a PhD. But remember, doing a PhD, it involves developing skills which are suitable for any career, such as professional, business, and management. However, it's a huge commitment and investment, such as in time, money, and other things. So that is my advice to my fellow colleagues. And thank you everyone for making this happen, and thank you for attending.
Thank you, Catherine. Thank you very much for the presentation. We will skip again the questions for the end. So I invite you to stay, please. Now I'm glad to present to Louis Dija from Zimbabwe. He's alumnus from the Master of Statistics from the years 2003-2005. And he has, as he will explain, he has a very long experience in working in the private sector. So, Louis, do you hear me? Louis? Louis, you are mute. I see Louis here in the list. But Louis, do you hear me? Your mic is mute.
He just asked how he can unmute. So probably.
I cannot unmute him. I can only mute people, but I cannot unmute. Louis, do you hear me?
Louis, there's a button below. You see the microphone in the middle below your screen. There you can turn it on and off normally.
Hello?
Yes, we hear you.
Yeah.
Louis.
Okay. So it's the confusion of the screen and using this platform for the first time.
No worries.
So you can hear me now.
Yes, we hear you very, very well. Do you want me to share your presentation, or you will do
I'll
it?
share my presentation.
Okay.
Yeah. So thank you for inviting me to share with you my experiences. But I was more biased, so I decided to share my experience, what I'm working on. But I'll just briefly mention who I am and where I've come from. So I think, let me see. I'll just mention where I come from and what I'm doing currently. So I did my undergraduate statistics degree in Zimbabwe in statistics, mostly focusing on mathematical statistics. Do you see my screen?
No, yet.
Okay, let me see. Entire screen. So I think you see my screen now.
It's loading. Yes. Yes. Now I see.
Okay.
I see myself in
So
your
I'll
screen.
just
Yes.
okay. So I'll just mention briefly. So I did my bachelor's degree in Zimbabwe, where I was focusing on more mathematical statistics. And after a year, between the year when I finished my bachelor's, I did a bit of few things. I did a sentinel site surveillance, like poverty assessment in my country, where I was leading the province of Manicaland, where I come from, in assessing the poverty levels there with the UNESCO and also the Ministry of Social Welfare. And after that, I went into investment. So I became a money market dealer for whilst I was waiting to come to Harvard after I got my scholarship. So after that, I went on to do an applied statistics where I did my thesis with Helena Gaze, which had something to do with comparison of schizophrenia. And after that, I also did a master in biostatistics where I had a thesis with Professor Neil Hens and Professor Nicholas Paybrook, who was at that time at the World Health Organization. And after that, I decided to follow Emmanuel Laissez-Faire to Leuven. And of course, I changed my color to be a Bayesian from being a frequentist. So I ended up finishing my PhD in 2011. And I decided to also go to Karolinska to pursue, to continue my research with register-based databases. Then in 2012, I decided to come back to Belgium in joining Janssen Pharmaceutica, where I entered the non-clinical statistics world, which I'll talk about today. And I've been in the what we call the manufacturing part of the statistics world. And last year in July, I decided to switch to go to discovery. So at the moment, I'm an associate director in what we call TMEDS, where I'm focusing on discovery and non-clinical safety statistics. So that's in brief who I am. And if there are people interested to go into more details what I did and the publications, you can just go to my LinkedIn page. And of course, also we can always network so that you understand what we are doing. That I can share also what you can do to get into the world that I'll be talking about. So that's about myself. So I think, let me see, I need to share this. So today I'll talk to you about non-clinical statistics world. I will just briefly touch on some example of what we do and some opportunities that you might find interesting, because most of the time I believe when we talk about pharmaceutical statistics, we focus mostly on clinical statistics. So the idea behind the pharmaceutical development pipeline is that we want to design products which are of a good quality, and also that the manufacturing line itself is not interrupted, that it gives us good product, but also it's consistent. I think these days you can understand with COVID that when there's a recall, it's really catastrophic. A catastrophe. You can think of India at the moment, that if, let's say, Janssen product is recalled or a Pfizer product is recalled, it really is a needed drug and it can really cause havoc on the market. So one thing we do is we try at least to account for all the risks as we go through the pharmaceutical pipeline and see what risks can be carried forward and what risks have to be mitigated. So at the end of the day, all these pharmaceutical development studies have to be based on the quality risk management. And what do I mean by that? This is actually an interdisciplinary team of experts where we bring people with knowledge of chemistry, knowledge of biology, engineers, and also statisticians. Then we want to quantify risk, not only from the perspective of chemistry, but also from the perspective of even the financial part of the company. That at the end of the day, we want to maintain the company to be able to produce medicine, but also balancing that with the consumer risk, that is the health of the patient. So essentially, statisticians are there to quantify risk and to bring an understanding to the sources of variability at every stage of pharmaceutical development, research and development pipeline. So that's what we do. We deal with variability, we deal with risk, and making sure that these risk concepts are understood in the various disciplines in the company. And also because we need also to go to the authorities, the FDA, the EMEA, to present this statement in a language which is understandable, not a statistical language where we deal with betas and alphas, but a language which the everyday man can understand. So when I talk about the pharmaceutical development pipeline, this is what I'm talking about. We start with the preclinical studies. Here we are looking at the chemists and the biologists thinking up of a molecule and how this molecule work. And hopefully this molecule work well in animal models. And after we found molecules which work, we now need to package them to be a component which goes into a human in a clinical trial after having filed what we've discovered with the FDA. That's why we make our tablets. That's why we add excipients like to make the tablet test well, to make the tablet be absorbed, and all sorts of things. And from there, we go on to this phase 1, phase 3, where the clinical statisticians will deal with that. Then finally, we file our vaccine, we file our pill, and then it's approved by the authorities, and then we have it on the market for the patients to alleviate their pain or to get better in their situation. So when we look at this, there is a divide in the pharmaceutical world. We have what we call non-clinical statistics. Usually this is statistics which applies to or is limited to things which do not involve humans. But you find that this is just a cutoff which is there in general, but you find that non-clinical statisticians can also enter into the clinical world also, because it's all linked, it's one pipeline. Then we have also clinical statisticians, and these are normally the statisticians in clinical trial supporting things which are needed by the FDA. And in the non-clinical statistics area, we can divide it into 3 parts. We have discovery, where we work with biologists who are looking at the molecule which come from the chemists to see how it works, how it can link within the omics setup with certain genes, and how it can shut down certain receptors on certain cells when it comes to oncology. And we also have non-clinical drug safety, where we look at, we have found an efficacious drug, but then can it be tolerated by a patient? So we have to apply this also in animal model at the earlier stage. Then we come to the chemistry, manufacture, and control, where we are looking at things like expiry date. Does it dissolve well? So when you get recommendation from your doctor, like you take the tablet 1 time a day, you take the tablet 3 times a day, it all comes from statistics. So behind all these things like the expiry date and the dosage, and also the dosing range of a tablet through the day, it is statistics involved in that. So I'll discuss that briefly to give you some examples. So I'll talk about non-clinical, preclinical studies in this. I'll not talk about clinical. I think for clinical, even in statistical courses, you get to learn a lot about that. So I'll talk about discovery, which is in red here, and I'll talk about manufacturing, which is in blue. For my work in Janssen, I've been from 2012 till last year, I've been in the blue area here, where I'm supporting manufacturing. But now I move to see where the actions start in the discovery part. So discovery studies is concerned with actually you want to identify the chemicals which you can use to fight a disease. And after you discover those chemicals, you engage biologists to now see the mode of action of those chemicals. So that at the end of the day, when you go to the authority like the FDA or the EMEA, you really understand what you're proposing as a new molecular entity that you want to push in your pipeline. And there are skills involved which are general. I just put some general skills. But the first thing is communication. As I told you that the risk management is managed by an interdisciplinary team. So you need to be multilingual. When I say multilingual, I'm not talking about speaking French or Japanese. I mean speaking the language of chemists, biologists, or even of business people. So at the end of the day, you need, like what was presented about funding, you need to be able to embrace your partners and know what they are talking about, and know there is even reservation when you come to propose them, let's say, a p-value or a confidence interval. So you need to be able to adapt to their, so that they can learn from you also. So it's a give and take mentality. So we find that in discovery, it's a lot frequently statistics use, but also we are trying to drive some Bayesian statistics when it comes to certain aspects which are easy to calculate using Bayesian statistics. Then we have also omics data, which comes into play. So we need also not only to learn biostatistics, but also to learn the bioinformatics, statistical bioinformatics, and even epidemiology. So also of interest is software skills, which you can use to help you to not always to be there to push the button for scientists, but to allow them to be part of the process when it comes to statistical analysis, where they can run things on shiny applications. Then also another part is to train them to have good design of experiment so that they can easily disentangle variabilities, disentangle the effect that they want to look at. I will not talk about toxicology because of the time limitation, but however, in discovery, you're trying to find how effective your molecule is, but in toxicology, you're trying to play also to the safety of the patient. So in discovery, I decided to give you some examples. So in discovery, normally in oncology, where we are dealing with cancer, we know that cancer cases is hard to treat, and there are no clear medication that, or we can say the golden pill for cancer. So we find drug A is effective for, let's say, a cancer, and drug B. So what we try to do in what we call combination of synergistic studies is that we try to bring these two drugs together. And we hope, like in this diagram, that we have concentration of A and concentration of B. If you combine them, you find that your cancer cell, we can say your cancer are killed more. So you expect this to come from the diagonal to go down so that you have a bigger effect. But if it's actually lowering the effect, it becomes antagonistic. So we find something like this. We can have a plot where we have a surface, and if your points for the combinations are below the surface, you have a good or a synergistic drug combination. If they are above, it's really becoming even less beneficial. And I think I'll click here and to just show you something. Let me see. Let me come out of. So this is an example of such a combination. We have two drugs, A and B. We have the dose effect here. And when you combine them, you get another plot, which I'll show you. Oh, let me see. It's supposed to be here. So I don't know why it's not plotting. But anyway, don't worry about it, I think. So basically the plot will be like this, where you can see in two-dimensional if you have a synergistic effect or an antagonistic effect, or it's nothing, it's just additive. You add the two drugs and they go to different site of action and they continue to work. Then before I go to the next one, what we are trying to do also, which is a current project in which we are dealing with, is to try and have an economic selection of candidate combination, because when we do these synergistic studies, we might have 20 drugs to combine to have 2x2 combination. But then if you are going to do it, you are going to spend a lot of resources where 70% of those combinations are not going to be effective. So we have tried to embark on putting a design of experiment to already filter through the non-significant synergistic effect before we go to invest a lot even to do the full range of the dose response for drug A and drug B. So that's something we are looking at also, to use design of experiment to cut back on the costs of developing drugs. Then we know that when we are in discovery, we also do experiments on mice, for instance, or on animals. And normally from ethical committees, we are not supposed to just collect 100 mice. So if you come in pharmaceutical and you talk about, I want an experiment, you cannot expect to get 1,000 mice. We are bound by ethical consideration to take a few. So, however, when we do that, we have a challenge in traditional randomization. So at the end of the day, we develop apps also to help scientists that they can randomize their own mice, a small number of mice, but accounting for all the prognostic factors. And we have an app called Irini app, which scientists can just use instead of us sitting down with them and doing an analysis to create an experiment every time. They are able to do that because we know what they want, and we have developed a tool which can visualize what they want. So in the interest of time also, I will not go deeper in the example, but I just want to mention that we talked about discovery, and discovery is looking at the new molecular entity. When you got the new molecular entity, you want now to make this chemical or this biology to make it able to be designed for a human. So we find that in CMC, there are a lot of things being done to understand the quality of our drugs before and when they are in clinical trials, so that we prevent unwanted effects on people. So we find that actually communication again is important, not only of the interdisciplinary team, but across the pipeline, because the discovery people have to feed the CMC people to be able to understand what is it they have, so that they can build a good profile for the drug. So here we find that Bayesian plays an important part. It's not in brackets now because it really plays an important part. You need to calculate the probability, the risk of even not getting the dosage which is intended for you. We have design of experiment because now, unlike in discovery where it's less regulated, in CMC you have to supply documents to the authorities. So everything has to be above board. You have to check quality. You have to check what you are writing. Is it statistically sound? Is it biological or chemically sound? And we also help in having our markdown reports for scientists that we can easily change and adjust things when needed, even for the reports for regulators. And just to give you an example, so when you are assessing quality of, let's say, a drug, you are not going to look on one thing. You are going to look on various things, the ingredients itself in the drug. You are going to look at the excipients or let's say the sugar you want it to taste well, let's say for babies. And you are going to look at which packaging is good. And you are going to have measures, what we call measures like assay and dissolution, water content, how much water is in your drug, the color, its ability to disintegrate. So at the end of the day, we normally, when we want to create drugs, we put the drugs which we formulate into a stability chamber. What is a stability chamber? It's like this thing. It's not always looking like this, where we look at the climatic zone in Africa, in Brazil, in US, in Asia, and also refrigerated conditions. And these conditions are the conditions we see on this planet, so that we make sure that our drug is good when it's posted to Zimbabwe, when it's posted to France, when it's posted to Asia. So, and when, for example, you look at assay is just that the ingredient in the drug. If we say we have to have 5 milligrams, it should be, let's say, 90% of that 5 milligrams should be there in that drug if we are to consider it to be effective. So here we monitor the drug for some time, for months, and we check where, if we put a prediction interval, where it cuts the 90% line. So that will be to say our shelf life here, for instance, is 20 months here, because we know our drug for some of the batch is failing below the line at that time. So that's why we need Bayesian. That's why we need also to do mixed models and also to do fixed effects model to come to an understanding of when we put our drug in the pharmacy, how are we going to gauge the time it is going to be effective for a patient? So that shelf life, consideration. Then we also have a specification setting, where we look at which specification can we file with the authority. Then you all use also studies for that. And one thing which I wanted to share is that I'm talking about this stability monitoring. Normally, we know our drugs normally can take 2 years, but you cannot go to the clinic before you file for some form of specification. So you cannot wait for 2 years. You lose money. Your drug will be late on the market. Like, for instance, if you look at the vaccines that we are having, you cannot wait too long because it's needed. So what we normally do, we do what is called accelerated predictive stability testing, where we stress test these drugs. So from an equation by Swande Arenas, who linked degradation rate to temperature, we extended that to include humidity, because when you look at temperature conditions, which I have showed you, there is temperature and humidity, and these two things affect the durability of drugs. And I will not talk much about how you get it, but it's all statistical derivation and linear mixed model, and you can do it in various ways to get to let's say, some shelf life.
Sorry to interrupt, can we wrap up
okay.
in a minute? Thank you.
Yes. So the other part which I wanted to mention in CMC is also dissolution. What I talked about, that when we need to know the required percentage of the active ingredient to release in a given time. So if you have a headache, how much of the drug you need to take? So if it's what we call, let's say, a drug which can release the whole day, you can be given one drug. But if it's a drug which is immediately eliminated, we need to give in the morning, in the afternoon. So what the doctor tells you, it's actually coming from a statistical evaluation of how your tablet dissolves. So we can think of it as efficacy within a day. But we need also to maintain a consistent behavior across time. So at the end of the day, also we can model the stability of dissolution. So dissolution, I'm just giving the screen here. What it is all about: you dissolve a tablet and you monitor it. You use HPLC to measure the concentration, and you monitor it over time. And here I just give an example where you model the dissolution let's say within a day with this dissolution time using a beta regression model. And here I've just put the code of how you'd do it in R. Then to conclude, I just try to give you a glimpse of non-clinical statistical world, because most of the time, even in my time, I didn't know about this world. I only know about clinical statistics. So when I entered that world, it was interesting to me. And you find that for clinical, you are highly regulated, because in clinical trial, you're going to the authority, but you can have more fun in non-clinical statistics. You can try your models, even coming from an academic setting, of the things which you want to do. You are more flexible. DOE concepts are important, are very much required in CMC statistics. So it's good to have a basic understanding of that. But also in discovery, we are also trying to promote that within the people, the chemists, to understand what is going on. So to paint the risk map at every stage, we need an interdisciplinary team of experts. And the non-clinical stage is pivotal in balancing competing risk narratives, because a risk to a chemist and the risk to a biologist are different, or a risk to we can say the shareholder. So we need to be able to balance all these things and to be able to speak their language. And of course, when we have this multilingual concept or languages in terms of our fields, we can have more fun, because we now understand the direct impact of what we're doing as statistician towards the other fields. And I just put some books if you want to know more. There's a book of non-clinical statistics which you can read. There is also a book of CMC and also some Bayesian concepts. So I hope I've given you a brief of how the world of non-clinical statistics looks. Sorry for speaking at an advanced stage, at an accelerated stage, but I hope to just share briefly what we do, and hope to see students also being able to come and collaborate with us. We usually invite ourselves like to HASOT when they have the Masters Day, and also to Ghent, when they have a Masters Day there to really look for research. We are always open to collaborating with academia, like we are always doing that to be able to also get more methodological development in non-clinical statistics. Thank you.
Thank you, Louis. Very comprehensive presentation and very interesting also. We will skip the questions also for the end. We'll have our last speaker. So this is Nang Thuy Tran from Vietnam. She's an alumnus from the Master of Epidemiology from the years 2017 to 2019. And currently she's a PhD student at the University of Antwerp. Nang, please could you, you are sharing already.
Yeah. Can you hear me?
Yes, I hear you very well.
So now Luis is still sharing his screen, I think. Yeah, okay.
While you are launching your presentation, for the participants, please, I'm sharing with you a link for a contact form. So please fill in your contact details there. This is in the chat. Okay, now thank you very much. Please, the floor is
yours. Can you see my screen now?
I see. Yes, I see the Chrome. Not yet the presentation, but the Chrome web browser.
I don't get it. So
I see your screen, but not the PowerPoint.
Oh, not the PowerPoint. Okay.
Yeah, you have to share an application and then choose the PowerPoint presentation and not a screen. You have 3 options, and it goes to application and then choose the PowerPoint application, the presentation form.
Yes.
Okay.
Yes.
Perfect.
Thank you. Okay. Hello, everyone. So in my presentation, I will share with you my journey going from MEPI to a PhD in preventive and social medicine at the University of Antwerp. So what comes to my mind when I think back about our MEPI, I had a lot of beautiful memories with my classmates. So in this picture, you can see us exploring Antwerp together. And during our master, we also had a lot of times when we could get together and we exchanged the culture from our home country and also the typical food from our home country. And more importantly, the MEPI laid a solid foundation for us. So after our master, we went for a PhD in numerous topics. You can see some of them here. So for example, colorectal cancer screening or genomic epidemiology or cardiovascular diseases or the vaccination programs in Belgium, also current methodology for model validation and assessment of clinical utility. For some of us, we didn't have any background or experiences before we got to these topics. So my message here is if you are interested in a PhD and you see an interesting topic, but you are afraid that you don't have any background or experience in that yet, but I encourage you just go for it. And then once you get a PhD, you will have some time at the start of your PhD to learn about the topic. So in the next few slides, I'm going to share with you more details about my PhD topic. So my topic is on colorectal cancer screening in Flanders. So in Flanders, every individual eligible for the screening program from 50 to 74, they got a fecal fit test, which is to detect a small amount of blood in the stool. So they got this test for free every 2 years. And after they have this test positive, they go for colonoscopy, which is a flexible tube to examine the colon and rectum, and to take a biopsy or to remove polyps if there are any. So the program has many benefits. It helps to detect the early sign of cancer. It reduces mortality. So the FIT test reduces mortality by 16%. This test is free of charge. It is sent home via post, so no transportation is needed, and the results and follow-up information are systematically stored. However, it still has some issues, like the participation rate in this program is low, only 50%, although the test in the program is free of charge. Some people, they still go for the non-organized test, so they order the test online, or they buy the test at the pharmacies, and these tests are not free of charge. And also, when they go for a colonoscopy, they can have a certain risk of complications, for example, bleeding, perforation, or death. So this is also the interest of my PhD. The first topic is we want to understand the factors associated with organized and non-organized screening using FIT tests. So we have data from 308 municipalities in Flanders from 2015 to 2017. Our outcomes are organized and non-organized screening coverage by FIT, and our exposure are socioeconomic, demographic, and health-related factors. And for these variables, we got the data from the provinces.incephus.be website. But for the inside-outside coverage, we have the data from the Center for Cancer Detection. So as you can see here, we need to we get our data from two different data sources. So what I applied in this project from the things I learned from our master is first about proposal writing. Because before we do any research project, we need to convince people that our project is worth doing. And in our master from the first semester, we already have a module called the research project, in which we learn how to write a research proposal. And the second thing I apply in this project is about data management, because we need to make a link between the data from the provinces and the data for the Center for Cancer Detection. So basically the exposures and outcomes, we need to make sure that the data link is performed properly. And in this case, I also use the DAG to identify confounders, because here you can see we have almost 20 variables, and some of them are connected to each other. So that's why we need to use the DAG to identify the confounders. And in this project, we have both the outcomes and exposures repeatedly measured each year. That's why in this case, we use the GE method, the generalized estimating equation, to tackle this matter. The second topic of my PhD project is colonoscopy-related complications in the context of colorectal cancer screening. So as I said earlier, after a person has a positive FIT test, the person goes for colonoscopy, and the person has a certain risk of colonoscopy complication. So as you can see here in the picture, this is the perforation complication. And the problem now in Belgium is that we don't have a central registration of colonoscopies, and the complications are not systematically recorded. However, the people who go for screening, they need to know the information about the possible complications of colonoscopy so that they can make an informed decision about participating in screening. That's why the aims of our study are to describe rates and characteristics of serious colonoscopy-related complications, in this case, bleeding, perforation, and death in the context of colorectal cancer screening. And also we would like to identify the risk factors associated with the occurrence of these complications. So in this project, we also obtain our data from 3 different data sources: the health insurance data, hospital discharge data, and the data from the Belgian Cancer Registry. Outcome here is colonoscopy-related complications. So for this, we identify the complications based on the procedure to manage complications from the insurance data, and also the diagnosis of complications from the hospital discharge data. For exposure, we have individual related factors, for example, age, gender, socioeconomic status, comorbidities, the use of some medications, which increases the risk of complication. We also have some factors related to colonoscopy itself, like, for example, whether a polyp was detected during the colonoscopy and was removed, about the anesthesia procedure, about the endoscopist experience and specialty. Also, there are factors related to the lesions, like whether a lesion was detected during the colonoscopy, or about the lesion's characteristics. So in this project, what I applied from the things I learned from our master is first also the study proposal writing. The second skill also data management, because in this case, we even have data from 3 different sources. So it's very important to make a correct link between the databases. And in this case, we use a case control study design. So those people with a complication are the cases, and those people without complication are the control. So as we learned from our master, when we study the risk factor related to an outcome, is a proper study design. And in this project, I also learned new thing, which is authorization, writing an authorization demand, because here when we want to link the data from these 3 data sources, we have to submit a demand to the data privacy committee, and we need to convince them why we need this data, these variables, and whether we can guarantee data privacy in our project. In the last slide, I just want to share with you a few words about the practicalities when you want to go from master to a PhD. So there are several options. The first one is you can apply for a PhD during the last semester. Like, for example, in our MEPI, for the last semester, we only focus on our master thesis. So we only have 2 courses in the last semester, and the time is quite flexible. That's why you can use this time to apply for a PhD. Or you can also apply for a PhD after graduation, before going back to your home country, because we graduate in June or August, and then we need to return to our home country in October. So there is still some time in between that you can apply for a PhD or a job if you want to focus on your thesis during the last semester. And the third option is you can go back to your home country, work for some time, and apply for a PhD afterwards. In that case, you don't have pressure about time, and you can also go back to visit your family for some time. And then a small point about like in the case you are married and you have your husband or your wife or your child at home, and it's already hard for you to have 2 years far apart from them, and now you want to do a PhD, but you don't know whether it's difficult in that case to bring your family with you. So from my own experience, it's possible. So you need to go to come first to prepare the documents for their visa application, and the application process takes about 3 months. But during that procedure, you will get a lot of support from the HR department. Are you still following?
Yes, I don't see your
Yes,
screen.
we are.
Yeah. So that's all I want to share with you today. And if you have any question, we can discuss further during the group discussion.
Thank you very much, Pam. Quite informative. Well, we'll skip all the questions for the group discussions indeed. So now we are a bit late on the schedule, but anyway, we'll have a 5 minutes break. So now it's 3:10. We can come back at 3:15. Yes, at 3:15 Belgium time. And then we will have a short talk from Hayat Bentohumi, which she's a PhD candidate here at the University of Antwerp. She will talk about the alumni network that we are trying to create. Okay, thank you very much. At 3:15 we are going to be back. Okay, thank you. Okay, I know it was a very short break, but yeah, time is not on our side. Okay, so now we will continue. As I said, we have now a Hayat Bentumi. She's a PhD candidate at the University of Antwerp, and she will provide an overview about the plans on the alumni network here at the Master of Epidemiology. Hayat. Hi.
Yeah, thanks, Christopher. I'm trying to share my screen. What is this? Okay, I found it. So it will be very short. Just to inform you guys. Good afternoon, everyone, by the way. I hope you can all see the presentation. I'm just not sure.
Yes.
Yes, okay, that's great. So I guess I have to do something like this, yes. Okay, so we are actually planning. Yes.
It's not yet in the presentation mode.
No.
Do you want to? No.
And now?
No. Still in the edit mode.
Strange. Wait. And again?
No. You can.
You have to choose another tablet or another screen. You've chosen the wrong screen.
Oh yes, I see why. I think it will work like this. No, it's not working.
It's in your Zoom tools.
I have. Oh wait, I'm trying something differently. I have two screens, and that's why. Maybe this. Okay.
Normally. Venster gaan en dan venster dat je ziet. Ja, perfect.
Yeah.
Okay, perfect. I hope it keeps working like that. So, yeah, good afternoon. Well, I'm here to tell you something about our plans for establishing an alumni society for the MEPI specifically. A very brief presentation about how many cohorts we have until now of students and what the plans are. Do you see another?
No, still we see the alumni society maybe.
Yes. Strange. Okay. Yes. Okay. So until now, we have had 8 cohorts of MEPI students, which means that we have 7 cohorts already of alumni. The first alumni graduated in 2014, and since 2017, we also have the Vleer-Uos Scholarship, of course, and from the Vleer-Uos Scholarship, we already have 23 alumni around the world, if I can say it like that. So why do we want this MEPI Alumni Society? Because it has been an idea that has been in our heads, I think, for a while, for most of us. Well, first of all, of course, to keep in touch. And secondly, we would also like to organize these networking events or other events that are relevant for our alumni. Of course, the program wants to stay in touch with the professional field. So we want to know where our graduates, where they go to, so to have a contact with the working field, actually. And of course, such an alumni society can also be very valuable to bring together alumni, the international and the national students, of course. And for this, because we are planning to establish this, we of course needed some information on what your needs as an alumni are, and how you see this type of society, and how you see the type of events, what you would like to see that we organize for you, and so on. So we have created a little survey, and I have been distributing this survey now. And I saw that I got some responses, I think 19, so which is good. But for the alumni present here, please spread it to all the other alumni, because some of them might have received it and others maybe not. We would be very happy if you would fill it in. And I will present to you some basic results from this survey, so to get a view of how our pool of alumni looks like. So we asked them some general questions like gender and so on, but that's not really relevant now to present. So we asked our alumni which degree they had before they started the Masters of Epi. And you see that more than half had already had an academic master's degree, and then they did this additional master's next to the master's they already had, of course. But we also have people who had an academic bachelor's degree and did not do a master's yet, and also other degrees with other, I mean, a PhD, for example. So we asked them also whether they are currently employed and in what sector our alumni are employed. And from all the answers we have received, we see that the majority of our alumni are currently employed. And half of them is employed in the academic sector. And then you see 22% is employed in the public services, government. And we also have some alumni that are working in the pharmaceutical industry, of course. And then a very important question, I think, is whether they consider their degree of Masters of Epi to have added value for their current position. And 100% of the alumni that filled in the questionnaire answered that yes, it has added value for the work they're doing right now. So that's very good. And we also asked whether it took them long to find a job after they graduated, and we see responses from 0 to 8 months. 8 months was the maximum before they had a job. And also, of course, we would like some input from the MEPI alumni about the events they're interested in. So we asked, for example, so what would they like as an event, and what was what the most reported was that they would be interested in a yearly symposium, for example, or some lectures, and maybe also online, of course, because we have to keep in mind that we have our international students who should be also involved and reached, and also get-togethers, of course, to be able to network, to meet each other, because the students from 1 year know each other, but of course they do not know each other over the years. So that would also be interesting. And we have, what came up was also networking events and also maybe a periodic. So these are just ideas that arise from the questionnaire. And what was also very common was that from the ones who answered, they said that they would also like to collaborate maybe with other colleague alumni. So that's it, actually. And I have this survey now online. So if you know, as I said, if you're an alumna, please fill in the questionnaire. And it's the society itself, it's not established yet. So I think we have to think very good about first events we're going to organize and how to launch this. But just know that we are planning this, and that you can expect this alumni society in the near future to appear. And also for the alumni maybe who do not receive these emails, this means that you're not registered in the central administration of the alumni. If you want to be contacted by us, so by the Alumni Society, please provide your email address. And that's it, actually, that I wanted to say. I wanted to introduce this and spread the word if you know other maybe alumni that are not here. Thank you.
Thank you, Hayat. Thank you. Okay, so now, because we have been skipping the questions to the speakers, I think a good opportunity is to have these breakout group sessions. So using Google Meet, I will split the participants randomly, and so we have there like 20 minutes to talk to each other. I mean, to talk to the alumni, or I think Jean-Pierre is also there, the professors. If you have some questions regarding the master or how is or the perspectives after the studies, and then after that I will rejoin all of you in one session, and we can just have 10 minutes as an open session for further discussion about this. Okay, I will split. The first time I'm doing this, we'll split you into now we are 39 participants, so I will do it in 3 groups. Jean-Pierre, I don't know if you would like to add something before. Jean-Pierre? You're mute.
No, I think I was impressed by all the presentations, and also like that little statistics, Vayat, that 100% of the alumni have a job in the field of epidemiology after their diploma, which again shows, next to the high amount of applications, it shows also the high, it's a confirmation of the high need of epidemiologists in the field. So I think, and yeah, let's move on with this, and then now let's have a little chat. Have you prepared? Did we prepare some questions in this regard, Christopher?
We will discuss mainly about the experiences of the. I mean, we don't have a specific question. Is more the questions to the speakers, because we didn't have the time to.
Okay. So we have 6 speakers. So 2 speakers per group, an epidemiologist and a statistician, maybe.
That's what I'm setting up right now. In the meanwhile, if any of you have any questions, please just go on while I'm constructing the groups. It'll take 1 minute more. Okay, I will open the groups, so you will be split in 3. Okay. Okay, I see there are already 3 groups working. So do you hear me in this group? I see Hafsa, Donna, Ezequiel, Jorge, Dubu, Seiji, and Longla. Do you hear me? Okay, welcome back to all of you. I hope you have a very good discussion. We have still 10 more minutes, so if you have questions to other speakers that were not in your group, please come ahead with the questions. I don't see all the speakers here. Wait. Sylvie, are you there?
Yes, I'm here.
Okay, it's taking at some time. But all the participants are coming back to the main meeting. So I was saying, because now all the speakers are here, so if you have further questions, please, this is the time. We have still some it's 5 minutes to have a few questions. Maybe some speakers that were not in your group, or if you have something to share, maybe from the speakers, some final words, maybe some tips or advices. I heard from some groups that there were some questions regarding about, for example, when to start to publish. And my advice is that if you are doing your master thesis, try that your master thesis becomes a publication at the end. It's a lot of work to do during the master thesis, so I think it's worth it to have a publication, especially because when you want to apply for a PhD vacancy, it's an added value that you have a publication. So yes, do that, please. I don't know if Gang or Damaso, Veronica, would you like to say something else? Louis?
I can just say that as a statistician, you should always try to come out of your comfort zone. Then you have more reward for that, because when you go into other disciplines, you learn a lot even from biology, from engineers, things which you thought you knew more. Because I think also the drive for the statistics or even epidemiology also come from other fields. There are people in agriculture who did something exceptional, which we then adopt, and then it becomes a good idea in statistics. So I think we should always embrace that.
Yes, thank you, Louis. Damaso?
Yeah, just to add on what Louis has just mentioned, yeah, I touched base on it. There is a tendency for us to think that, okay, once I'm an epidemiologist, then everything I should do should be epidemiology. Once I'm a statistician, then everything is strictly statistics. And when you are in biostatistics, then you don't want to look at anything else other than bio. So I think that is a little bit something that we need to think about as professionals, because like I mentioned earlier, my experience has taken me to different parts and collaborating with different individuals and teaching courses in econometrics, etc., etc., etc. So for me, the advice for each and every person here is to, like Ru has said, to get out of the comfort zone and try to step out there, step out of the box, and try to look at the different opportunities that exist. I do not really think that people who are reading the biggest projects and interventions are made from heaven or something like that. They are just the same individuals as we are, and we definitely can compete or even sometimes outcompete them out there, and basically be able to establish our names. Over.
Thank you, Damaso.
Just so an anecdote, the Fisher from the Fisher exact test worked in agriculture.
Yes, and it was also one of the questions, and as Louis already said, and also Damaso, we during the PhD, if you are willing to go for a PhD, you will not only use the knowledge that you have learned during your master. That's something else. You will learn more topics to deal with the problem that you have to solve. So that was one of the questions also. Damaso, yes.
Just one more thing, Chris. I think, of course, the master gives us the platform to grow, intellectual and professional and make all these different collaborations. But I think just a word to say that there's so much that we definitely learn when we are already in the field. So you saw, like in my slides, I've mentioned there are some things that I am involved in teaching, which I didn't, for instance, learn during my master. So something like advocacy for research uptake. This is something I never learned. It was not a module during my ICP master, but it is something that I learned on job, and I was able to apply. So I think it is just to have that kind of open mind that for people who finish the master and maybe also finish the PhD, it's not the end of the world that, okay, what you know, that is, you must only know that. So I think people should be open to learning, taking up fellowships, being in different communities of practice, and at least so that you can be able to brand yourself as a professional that is multidisciplinary or interdisciplinary in that sense. Over.
Thank you. And something else also, Veronica, yes.
Yeah. I think just re-echoing what Damaso has just mentioned. Yeah, like one of the challenges that we usually have is when we finish, we are looking at what we have gained from class. And when we look at the opportunities out there and don't find it in there, we have a tendency to turn away. But we should really be open to challenges. I'm now in the fellowship where it is too practical. Like you get in there and you're like, okay, this is not something I would think I would do at this point. But you learn on the job, like Damaso has said. So we should be open to challenges. We should be open to taking on opportunities. You don't always have to say no because you have not done something before. There is still room for learning something. And most job opportunities, actually, that is why most job opportunities give a probation period. That is for you to challenge yourself and learn something. By the time they look at you and give that job to you, even with your thinking that you're not experienced enough, that means they have seen potential in you to do something. So we need to push and go for it and not limit ourselves.
Indeed. Thank you, Veronica. Yes.
Yeah, just to add one thing. I think also one thing which I learned when I started a postdoc in Karolinska is that, Karolinska is full of epidemiologists, and I was a biostatistician. So in looking for funding, at first I wrote my proposal like a biostatistician, and I never succeeded because the board there is more with epidemiologists. So I had to change my mindset to also learn from epidemiologists how to phrase things in the way that is understandable there. So I think also some of the frustration, if you look at them clearly, are opportunities that you can take and develop as an individual. Like Damaso put that you cannot only be a statistician, you have to be a statistician and epidemiologist in part. You can even be an engineer in part to understand all the concepts. Then you can become then a full package when you get those skills. Yeah.
Yes, thank you. Indeed. Something else, because Louis, your hand is still raised. Probably this was from the previous. Something that was also that I think is very important. It's networking, and I see it here. There are a lot of students that are still in the master. So I would advise you that you can do networking. You should talk to your professors, because you don't know after you finish your master, you can contact them to explore possibilities for a PhD or something like that. So don't try to work alone and isolate yourself. Try to do networking as much as possible. So that will open a lot of doors for you. Okay. We have further questions or comments? Edmund, maybe you can say something before.
Christopher, no, I haven't got anything to add, just to really support what the other speakers have said. I mean, so nothing to add from my side. From my side, I guess it's only to say that this workshop was very useful for all of us, the alumni, to see what our colleagues are doing. Also for the students to to learn one or two things. So thank you for organizing this.
Okay, thank you, Edmund. Okay, then Jean-Pierre, I will invite you one more time, maybe just to close the session.
Yes, of course, it was a virtual session for the circumstances you all know. Has a disadvantage then that the alumni, the students of the MEPI and the students of the Mass Statistics cannot gather, and then because it's a half social event that we skip in such methodology. The advantage, however, is that of course we can invite the whole world. However, that not the whole world was yet online here, I think today. But so it has advantages and disadvantages. And now I think I was very impressed by the presentations, especially if you hear some people who already graduated 5 to 10 years or even longer ago, that you see what impressive track they are following. I think it's for the students, this gives them a lot of perspectives, I think, that which is, I think it's very positive. We will further continue to build also on our programs. And I'm also always very impressed by our colleagues from Hasselt, because that ICP and the master program exists already for 20 years. So we are still a baby compared to Hasselt, but we can learn from. So we will also look to have some maybe online courses, maybe some adapted courses for specific target groups. It's all in the pipeline. So we work on that, and we will enhance the collaboration with Hasselt also, because I think epidemiology and statistics have there's a very clear overlap between both competences and skills. And so I think we should really continue to collaborate also over the institutions. I thank, of course, for the very professional presentations of all the speakers. And I'm sorry that it's all online and that we all have to watch a screen the whole day. And thanks for organizing this, Christopher and Sylvie and Shelafe. Anything to add? I don't know if I missed something, Christopher.
Maybe for the MEPI alumni, as you know, we are trying to we have contacted some of you for the to record videos.
Yeah, from the IUB. That's
yes.
yeah.
So, well, Sylvie has posted some information in our Facebook group, but yeah, I didn't get too much response, so we will start to actively contact you, so you don't surprise if I call you.
Yeah, just for your information, for the alumni of the MEPI, the IOB, that's our other partner, who is also, like the Master of Statistics of Hasselt, has already a 20 years ongoing program of masters. They have a program, they have some funding for making videos for the alumni, and they would also, a part of their own alumni, use it to interview and to make some video shots on alumni, which I think is very interesting, because it will be like the workshop of today. Afterwards will be posted and can be used for publicity, for everything, and to so we will try to contact you. I know you're all very busy, but for this.
Yes, maybe Chela, would you like to say something before we close from the Hasselt side?
Yeah, so yeah, I just want to thank everyone for attending this workshop, and also to Christopher and Sylvie for arranging everything for that we have this workshop now. So yeah, thank you to everyone.
Okay, thank you, Chela. Okay, so maybe we can have a group picture before we close the session. So please, if you could turn on your cameras, and then I would take a picture here. Okay. Okay, it's much nicer to see your faces than just the names. So we hope next year we will be able to meet in a future ICP workshop. Okay, I see. We're joining. Okay. Most of you have turned on your cameras. Thank you very much. So I will take the picture on 3, okay? 1, 2, 3. One more time. 1, 2, 3. All right. Thank you very much. And see you, hopefully see you next week. See you next year, sorry. Okay. Bye-bye. Thank you for the speakers. Very
Okay,
great.
bye.
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 Bye-bye.
Bye.